Nearly 7 million Americans are living with Alzheimer's disease right now. But here is the part many families never hear soon enough. When memory and thinking seem to fall fast, it is not always Alzheimer's, not always normal aging, and not always just stress. Sometimes the trigger is much closer than you think. Sometimes it is sitting in your pillbox, your purse, your nightstand, or that little PM bottle by the bed. And if you are over 60, your brain is often more sensitive to these medicines than it was 10 or 20 years ago. That means a drug that once seemed harmless can suddenly make you feel foggy, slow, forgetful, off balance, or frighteningly unlike yourself. Source: this is not fear talk. This comes straight from places like the National Institute on Aging, Mayo Clinic, the UCSF Memory and Aging Center, and the American Geriatric Society, whose Beers criteria is one of the best-known safety guides for medications in older adults. Their message is clear. Some common medicines can cause sudden confusion, worsen memory, raise fall risk, trigger delirium, that means sudden severe confusion, or add to long-term dementia risk, especially when taken often or combined with other sedating drugs. Source: and before we get into the list, if this channel helps you protect your brain, your balance, and your independence, subscribe now. It helps this message reach more older adults who truly need it. And for today, give me one easy comment. Tell me your age and where you are watching from. I always love seeing how many people are taking charge of their health all over the world. Number 1 is first-generation antihistamines, especially diphenhydramine, doxylamine, hydroxyzine, and similar drugs. These are older allergy and sleep medicines. You may know them as Benadryl, Unisom, or the PM ingredient hiding inside nighttime pain relievers. The surprising part is this. In older adults, these drugs are strongly anticholinergic. That means they block acetylcholine, a brain chemical your nerve cells use for memory, learning, focus, and clear thinking. The National Institute on Aging highlighted a major study showing that higher cumulative use of strong anticholinergic drugs was linked to higher dementia risk. And the Beers criteria warns that cumulative exposure is associated with confusion, falls, delirium, and dementia risk. Source: why does this happen? Think of acetylcholine like the text message system inside your brain. One nerve cell sends a message, the next cell receives it, and that is how your brain keeps track of names, steps, places, and conversations. An anticholinergic drug is like throwing a blanket over your phone. The messages still try to get through, but they are muffled, delayed, and sometimes lost. That is why a person can feel sleepy, scattered, or strangely disoriented after a drug that just helps with sleep. The common mistake is assuming over-the-counter means low risk. Many people take a nighttime product for months or years and never realize the memory cost may be building. The fix is simple but powerful. Read every label for words like diphenhydramine or doxylamine. Ask your doctor or pharmacist whether there is a safer option for allergies or sleep at your age. And if you are taking several products, ask for a full medication review, because the total anticholinergic burden matters. Imagine a 71-year-old who takes a PM pain pill, a motion sickness pill for travel, and a bladder medicine, all in the same week. None of them seems dramatic alone. Together, they can fog the brain like steam on a bathroom mirror. Source number 2 is bladder urgency medicines, especially oxybutynin, tolterodine, and solifenacin. These are often prescribed for overactive bladder, meaning that sudden, I have to go right now feeling, frequent bathroom trips, or nighttime urgency. Here is what makes this one so important. A large recent study found that some of these anticholinergic bladder drugs were associated with increased dementia risk in older adults, with oxybutynin, solifenacin, and tolterodine showing some of the strongest links. In that study, about 3 years of daily standard dose exposure over time was associated with roughly a 25 to 29% higher risk for some of these medicines. Source: why would a bladder medicine affect the brain? Because the bladder and brain both use chemical signaling. These drugs calm the bladder by blocking certain nerve messages, but some of them also cross into the brain and dampen memory circuits. It is a little like turning down the volume on a barking dog, only you also turn down the smoke alarm in the kitchen. The common mistake is thinking, it only works on the bladder. In older adults, that is often not true. The better fix is not to suffer in silence. It is to ask whether the bladder problem itself has a cause that can be treated, like a urinary infection, constipation, too much evening fluid, sleep apnea, or another medicine causing urgency. Also ask whether a lower-risk option or a non-drug approach makes sense for you. A bladder diary, pelvic floor therapy, and timing fluids may sound simple, but simple does not mean weak. Sometimes simple is what protects the brain. Tell me in the comments, do you think doctors warn patients about this one enough? I have a feeling half of you will say, absolutely not, and the other half may say, the warning was there, but no one explained why it mattered. Source. Source number 3 is certain older antidepressants and one newer antidepressant with strong anticholinergic effects, especially amitriptyline, nortriptyline, imipramine, and paroxetine. These are sometimes used not only for depression, but also for sleep, nerve pain, headaches, or anxiety. UCSF's Memory and Aging Center warns that these medicines can worsen memory and thinking in people already vulnerable to cognitive problems, because they add to that same anticholinergic load we just talked about. Source here is the easy way to understand it. Imagine your brain is a busy front desk in a hotel. Messages come in all day long. Who is calling? What room they need? What task comes next? Anticholinergic medicines make that front desk short-staffed. Calls pile up. Names are misplaced. Instructions get repeated. The common mistake is this. A drug started years ago for sleep or pain quietly becomes part of life, and no one asks whether it still fits your body at age 68, 74, or 82. The fix is not to panic and stop it on your own. The fix is to ask a very smart question. Is this one still the best choice for my brain at my age? That single question can change everything. I have seen people assume they were just getting old, when in reality, their medication list was acting like a weighted blanket on their thinking. Source. Number 4 is benzodiazepines, the calming drugs many people know as Xanax, Ativan, Valium, Klonopin, or Restoril. These are used for anxiety, panic, sleep, and sometimes muscle tension. Now, I want to be careful and honest here. The long-term link between benzodiazepines and dementia has been debated in research, and not every study agrees. But what is not debated is this. In older adults, these drugs increase the risk of cognitive impairment, delirium, falls, fractures, and heavy sedation. That warning is directly stated in the Beers criteria, and Mayo has also described short-term memory and attention problems with these drugs in older adults. Source. Why do they hit the brain so hard? Because they boost a calming brain signal called GABA, which acts like a brake pedal on the nervous system. A little braking can feel soothing. Too much braking, especially in an older brain, can make you slow, groggy, unsteady, and forgetful. It is like turning off a noisy alarm by dimming the whole house. Yes, the alarm is quieter. But so are the lights, the phone, and your sense of balance. The common mistake is taking them night after night for sleep, or continuing them for months after a stressful season has passed. Another mistake is mixing them with alcohol, opioid pain medicines, or other sedating drugs. That combination can be especially dangerous. The fix is never to stop suddenly on your own, because withdrawal can be serious. Instead, ask your doctor whether this medicine is still needed, whether the dose is too strong for your age, and whether a slow supervised taper or a safer sleep or anxiety plan would protect you better. Here is a debate for the comments. If a sleep or anxiety pill helps someone feel normal, is the trade-off worth it in later life, or is the memory risk too high? I know this one splits people. Let's hear both sides. Source number 5 is the so-called Z drugs, like zolpidem, ezopiclone, and zaleplon. Many people know zolpidem as Ambien. These are often marketed or understood as sleep aids, but in older adults they can act a lot like benzodiazepines, in all the ways that matter most. The Beers criteria says these drugs have adverse effects similar to benzodiazepines, including delirium, falls, fractures, more emergency visits, and very little real improvement in sleep length or sleep onset. That last point matters. A pill may make you unconscious faster, but that does not always mean you are getting the kind of sleep your brain needs. Source. Think of true sleep as the overnight cleaning crew for the brain. Your brain needs time to sort, store, and clear waste. A strong sedating pill can sometimes feel more like flipping the building's main switch. The lights go out, yes, but the cleaning crew may not work the same way, and the next morning you may wake up with a foggy hallway instead of a clean one. The common mistake is assuming any sleep is good sleep, or believing that because a drug is common, it must be gentle. The fix is to ask what is causing the sleep problem in the first place. Is it pain? A racing mind? frequent urination, snoring and sleep apnea, a late afternoon nap, another medicine taken at the wrong time? When you fix the cause, you often need less of the sedating drug. And that can mean a clearer morning brain. Source. Let me give you a real-life kind of story that I think many families will recognize. Mary, age 74, started forgetting appointments and repeating questions. Her daughter noticed she was also more wobbly getting up from the couch. Mary was terrified. Her sister had dementia, so she assumed the worst. When her medication list was reviewed carefully, 3 things stood out. She was taking a PM pain reliever most nights, a bladder urgency medicine every day, and a sleep pill when she felt especially restless. No single pill looked dramatic to her. But together, they were stacking like blankets over the brain. Her doctor did not promise a miracle, and I want to be clear, neither will I. But after a careful review and some changes, Mary became more alert. She stopped losing her place in conversations so often. Her daughter said, "It feels like Mom came back into the room." That is the goal, not magic, clarity. Sometimes the brain is not vanishing, sometimes it is being muffled. Number 6 is opioid pain medicines, especially when used with other sedating drugs. These include medicines like codeine, hydrocodone, oxycodone, morphine, fentanyl, tramadol, and older drugs like meperidine. UCSF warns that narcotics and opiates can cause confusion and falls in older adults. A review of opioid use in older adults found signals that tramadol and meperidine may be especially linked to delirium, which again means sudden severe confusion. Source. Why do opioids sometimes make thinking fall apart so fast? Because pain control is only part of what they do. They also slow the nervous system, worsen constipation, can dry you out, and may disturb sleep and balance. It is like trying to quiet a squeaky door by lowering the power to the whole house. The door gets quieter, yes, but so does everything else. The common mistake is stacking them with a sleep pill, an anti-anxiety pill, or alcohol, and assuming the body can sort it out. In later life, the body often cannot. The fix is not to fear pain treatment. Pain itself can harm sleep and thinking. The fix is to review the full picture. Ask whether the opioid is still needed, whether a different pain plan would work, and whether anyone is checking for constipation, dehydration, dizziness, and new confusion. If a loved one becomes suddenly mixed up after a pain medicine change, treat that as important. Do not brush it off as just old age. Source number 7 is muscle relaxants like cyclobenzaprine, carisoprodol, methocarbamol, and metaxalone. These are often prescribed for back spasms, neck strain, or general muscle tightness. The problem is that in older adults, they can leave you groggy, slowed down, and confused. UCSF says exactly that. Groggy and confused. And when the brain is slowed and the feet are unsteady, memory often looks worse too, because attention is the front door to memory. If you never fully pay attention, the brain never fully stores the moment. Think of a muscle relaxant like putting a heavy parking brake on the body's wiring. That may reduce the sense of tightness, but it can also dull reaction time and clear thinking. The common mistake is using these medicines as a nightly habit for aches that might be better handled in another way. The fix is to ask whether heat, gentle movement, physical therapy, posture work, or another plan might give relief without the same mental fog. Some of you will strongly disagree with this point because you feel these drugs are the only thing that lets you sleep through pain. If that is you, tell me in the comments. I want to hear your side, because real health decisions are rarely black and white. Source number 8 is gabapentin, and in some cases its cousin pregabalin. These drugs are often used for nerve pain, restless discomfort, shingles pain, and sometimes anxiety or sleep problems. Many people feel safer with gabapentin because it is not an opioid. But safer does not mean harmless for every older brain. One study in older adults with initially normal cognition found that starting gabapentin was associated with worsening cognitive and functional scores, and even increased falls later on. Source: why might that happen? Think of nerve signals like a radio station. Gabapentin can turn down the volume of overactive pain signals, which may help. But if the volume drops too much in the wrong person, the result can feel like brain fog, slower thinking, or trouble keeping track of tasks. The common mistake is assuming that because it is widely used for pain and is not a narcotic, it cannot be the reason your thinking changed. The fix is to connect the timeline. Did the fog, unsteadiness, or forgetfulness begin after the medicine was added or increased? That timing matters. Bring it up. Ask whether the benefits still outweigh the side effects for you, right now, at your current age and health status. That is a much better question than, is this drug good or bad? The real question is whether it is good or bad for your brain today. Source number 9 is corticosteroids, especially prednisone and similar drugs when they disturb sleep, mood, and attention. These medicines can be very useful for inflammation, breathing flare-ups, autoimmune disease, and severe pain. So I do not want to demonize them, but they can affect the brain. A major review of drug-induced cognitive impairment includes glucocorticoids, that is the steroid family, among drug classes known to affect cognition. Older studies have also suggested that older adults may be more vulnerable to memory problems with chronic prednisone treatment. Source. Here is the simple picture. Steroids can act like someone revving your body's engine too high. You may feel wired, restless, irritable, hungry, or unable to sleep deeply. And if sleep falls apart, attention falls apart. If attention falls apart, memory often follows. The common mistake is blaming the mind changes on fear, age, or the illness itself, without considering the medicine. The fix is to tell your doctor quickly if a steroid course seems to bring on agitation, major insomnia, racing thoughts, or sharp changes in memory and behavior. Never change a steroid plan on your own, but never stay silent either. When it comes to brain side effects, timing is everything. Now let's tie the whole message together, because memory improves when ideas are repeated simply. Number 1. Older allergy and PM sleep medicines can block acetylcholine, the memory messenger, and that can cloud thinking. Number 2. Bladder urgency drugs like oxybutynin may calm the bladder, but can also cross into the brain and add to dementia risk over time in some people. Number 3. Certain older antidepressants and paroxetine can add anticholinergic load and worsen memory. Number 4. Benzodiazepines may calm anxiety, but they also raise the risk of cognitive impairment, delirium, and falls in older adults. Source. Number 5. Z-drug sleep pills can act much like benzodiazepines and may give only small sleep benefits for a bigger safety cost. Number 6. Opioid pain medicines, especially when combined with other sedating drugs, can trigger sudden confusion. Number 7. Muscle relaxants may soothe spasms but leave the brain groggy. Number 8. Gabapentin can be helpful for some people, but in older adults it may also be linked to slower thinking, lower function, and more falls. Number 9. Steroids like prednisone can disrupt sleep, mood, and attention enough to make memory look much worse. Source. And here is the most important truth of all. A rapid change in memory should never be brushed aside. Sometimes it is dementia. Sometimes it is delirium. Sometimes it is a medicine side effect. Sometimes it is a mix of all three. But when the change feels sudden, the medicine list deserves a hard look. Not next year. Not someday. Now. Because the earlier you spot a medication problem, the better your chance of preventing more confusion, more falls, and more fear. Please hear this next part clearly. Do not stop major medications on your own, especially benzodiazepines, opioids, antidepressants, seizure medicines, or steroids. Talk to your doctor before major changes, especially if you take medication or have a diagnosed condition. Natural does not always mean risk-free, and this video is for educational purposes only. If this helped you, subscribe now, because this channel is about one mission: helping older adults protect their brain, their body, and their independence for as long as possible. And before you go, leave me one more comment. Have you ever had a medicine make you feel foggy, forgetful, or just not like yourself? Your story may help someone else realize they are not imagining it. And watch the next video, because I'm going to show you the nightly habits that silently age the brain after 60